Hello everyone. This presentation is on Bao He Wan, also called Preserved Harmony Pill. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Bao He Wan is classified under reduced food stagnation. A representative pattern is food stagnation with epigastric fullness, belching, nausea and foul stools. Important ingredients include shanja, shenk, lai fu zai, banzia, chen pai, fu ling, lion kyo. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 59-year-old man with dyspepsia and coronary artery disease. The current medicines are digoxin, metoprolol, atorvastatin. This case gives a plausible reason to consider Bao He Wan, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is shanja plus cardiovascular drugs. The mechanism is hawthorn can affect blood pressure, contractility and vascular tone, potentially adding to beta blockers or other cardiac drugs. The clinical significance is moderate in patients with heart disease. My management plan is monitor blood pressure and symptoms. Avoid replacing prescribed cardiac therapy. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is shanja plus digoxin. The mechanism is older interaction references raise concern for additive cardiac effects, although clinical evidence is limited. The clinical significance is potentially important because digoxin has a narrow therapeutic index. My management plan is use prescriber/pharmacist review before combining. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is digestive/motility herbs plus oral drug absorption. The mechanism is a formula that changes gastric emptying or causes loose stools may alter absorption of oral medicines. The clinical significance is usually low to moderate. My management plan is separate essential oral medicines when practical and monitor effect. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Bao He Wan may be reasonable when the patient's presentation matches food stagnation with epigastric fullness, belching, nausea and foul stools. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.